Good afternoon everyone and welcome all. Here we are today again with another interesting lecture about prevention of infection and control in daily basis. Presenting by Dr. Sumudu Suranadee, specialist in microbiology and senior lecturer of Department of Medical Biology and Immunology. She is a Bachelor of Medicine and Bachelor of Surgery from Colombo, Doctor of Medicine in Microbiology from Colombo. She has over 10 years of experience in clinical microbiology, including infection control in both local and overseas settings. So, madam, here's to you to present the interesting lecture today.
Thank you. Thank you very much, Natasha, for that kind introduction. And thank you very much, the GMOA, for inviting me for this lecture. So, as already mentioned, this is in next about 50 minutes, I'm going to discuss about infection prevention and control in daily practice. So this is the outline of my lecture. So I will be giving a little bit of background and definition, the theory, and then next we will discuss about the IPC, how IPC is applicable in our daily practice. Okay. So at the end we will take up the questions. So why are we so concerned about infection control and infection prevention and control? Infection prevention and control is there to prevent healthcare associated infections, or whatever I am going to discuss today in this 50 minutes is applicable to healthcare. So what are healthcare settings? So what are healthcare settings? So healthcare settings are, for examples, hospitals, outpatient clinics, and there are certain other places as well. So earlier, if you take about 20-30 years ago, healthcare it was limited to hospitals, but now it's not like that. The healthcare we have sort of taken healthcare out of the hospitals and taken into the community as well. So we have outpatient clinics both at hospitals and in the community. So, and we have our ambulatory care settings where the doctors and nurses and other healthcare workers, they go to the community and they give healthcare. So those are the ambulatory care settings. Then we have nursing homes and hospice where long-term people with long-term issues, problems are cared for. And we have rehabilitation centers. So those are the few examples of healthcare settings in all over the world. So whatever I'm going to discuss today, the infection prevention and control practices are applicable to these healthcare settings. So these infection prevention and control practices are not applicable to community settings such as schools, houses, homes, and other community settings. So we have to, on the outset, we have to understand that. Okay, and this infection prevention and control, it's not only for healthcare workers and patients, it's for everybody who visits healthcare. It could be visitors, patients, bystanders, or other people who entering healthcare for other services, for an example, maintenance people, because they are also at risk of acquiring healthcare associated infections. So let's see what are these healthcare associated infections. So if you take all the infections or infectious diseases, we can divide them into two broad categories. So we know what community acquired infections are. The infections we acquire in the community from our, from the family members, from our colleagues when we are traveling in the bus. So those are the examples are pneumonia, meningitis, simple UTI, influenza, COVID. The problem we had, still we are having the problem, the common cold, TB, measles, varicella. So those are the community acquired infections. And there are certain infections where you acquire them in healthcare facilities as a result of the treatment or other management interventions. So these are the ones I will discuss them in a minute. So this IPC is mainly to prevent these healthcare associated infections. So this is the strict definition where you develop HAI or healthcare associated infection in a hospital. So I'm not really interested about the definition, but why are we so concerned about this healthcare associated infections and IPC? The reason is these healthcare associated infections this is unwanted. Okay, this is unwanted, and if a patient develops a healthcare associated infection in a hospital, it will increase the morbidity and it will affect the patient outcome adversely, and it might even lead to the death of the patient, and it will cause some sort of definitely it will cause financial losses as well. So we might see this kind of newspaper headlines also. So what the origin of healthcare associated infection, this we need to understand this to prevent healthcare associated infections. So hospital environment is different from the community environment, because in hospitals we use lot of antibiotics and other chemicals to clean. So those chemicals, they are very harsh. So when we use those chemicals, all the harmless organisms, they die, and only the robust ones, they survive. So the hospital is a very dangerous place to be. So hospital environment is full of drug resistant and very hardy pathogens. So when a patient or even a healthcare worker enters the hospital, we get colonized with hospital pathogens. So these hospital pathogens can transmit from one patient to the other by our hands. That is the number one way of transmitting this infection, or by environment or uncleaned instruments. So to prevent this, we have infection prevention and control measures. So as I already mentioned, all these healthcare settings, I mentioned the outpatient clinics, OPD, the GP setting, the hospice, nursing homes, all have this problem. So these are the few examples of healthcare associated infection. The one which I have mentioned on the top of the slide are the typical ones: catheter associated urinary tract infections, central line associated bloodstream infections. These ones you find them in hospital settings and ICU settings typically. But in outpatient settings, we have another group of healthcare associated infections, which are they are originally community acquired infections, but if one of those patients comes to our setting, that patient can spread that infection to other patients. So one good example is viral respiratory tract infection. Now we all experienced how COVID has spread in hospitals. So if if a patient with influenza come and wait in a OPD waiting room for 15 minutes, that patient will give influenza to all other patients who are sitting next to him or her. Another notorious infection is hand, foot and mouth disease and scabies. Those are two well-known diseases that can be transmitted by touch. Measles and chickenpox, those are also can cause outbreaks even in OPD settings. Okay. So the prevention, as I already mentioned, healthcare associated infections by infection prevention and control, and community acquired infections by other measures which we discuss Generally we discuss in community medicine, under community medicine subject, where general hygiene, safe food handling, travel precautions, and vaccination and things like that. So I have to stress this, where we do not apply these IPC practices to prevent community acquired infections. Okay, so little bit about the history of infection prevention and control. So all these were started actually with with this HIV AIDS epidemic, because before HIV and AIDS, even the healthcare workers were not very concerned about this infection prevention and control, or acquiring or risk of acquiring an infection from patients. But with the HIV and AIDS epidemic, the healthcare workers, they understood that they are at risk of acquiring deadly infections from patients. So with this, a concept came up. So that is called universal precautions. So universal precautions means that we take precautions to prevent contact with patients' body fluids. Okay, body fluids. So this is simply the simple meaning of this is wearing personal protective equipments. Okay. So before that, we had something called body substance isolation, that is also kind of the same. But later, with other epidemics, and especially the hospital acquired infections and antimicrobial resistance, the healthcare workers understood that this universal precautions and body substance isolation is not enough. So we need something more than that. So these standard precautions came in. So just for your knowledge, I have listed out the standard precautions. Standard precautions are actually it includes the universal precautions as well. All these, it incorporates hand hygiene, personal protective equipments, respiratory hygiene, sharp safety, sterilization and disinfection, cleaning and disinfection of environmental surfaces, linen management, and waste management. So it's everything. So if you read a book, the book will say that you have to apply standard precautions to all patients at all time, despite the infectious status of the patient. So, but when you really go through the list, it's not practical, or it's not necessary to apply all these when you encounter in your all patient encounters. So I have given few examples here. If you perform a venipuncture, if you are taking blood or something like that, if you just put a cannula into a patient, you really don't need to practice all these. Okay, it's just a pair of gloves and then waste disposal and hand hygiene. Okay, but if you go and intubate a patient in an ICU or at the OPD, then you need more than that. So you may need a gown, you may need gloves, you definitely need gloves, a face shield, face mask, goggles may be indicated. So you apply standard precautions depending on the patient interaction and the extent of anticipated exposure of the situation. Okay. So I'm going to select few of these standard precautions and discuss how these are applicable, or how we are going to apply these in our day-to-day practice. Okay. Before that, there is something called transmission-based precaution. So standard precautions are applied to all patients in all situations, but transmission-based precautions are applied only in special situations. Special situation means if you think that the patient has that particular infection, or if that patient is definitely diagnosed with that infection, suspected or diagnosed. For an example, you take respiratory precautions if you suspect a patient is having COVID-19 or if the patient is diagnosed with COVID-19. Transmission-based precaution is always applied with standard precautions. Okay, transmission-based precautions is the next level of protection. So, standard precaution is the first level of safety. Transmission-based precaution is the second level of safety. Okay. So, I'm going to discuss the first standard precaution, hand hygiene. Hand hygiene is the most important, single most important measure or the single most effective measure in infection control. This is for both our safety as well as for the patient safety. So I have not written here as hand washing because we don't always do hand washing now. We have this sort of 70% alcohol hand rub instead of hand washing, which is very easy to use. Okay. So before going into the hand hygiene practices, so there are certain things that we need for hand hygiene. One is our attire. So when you entering to a healthcare environment as a healthcare worker, so you need to dress in a way which is appropriate for that environment. So it should be your dress or your attire should be scientific, and there should be an element of culture also there. So if you take our Sri Lankan hospitals, our attire is mostly it's cultural. So lady doctors wear saris, and male doctors, they wear like long sleeves and ties and all. But ideally, our attire should be scientific. Plus, there should be it should be appropriate for our culture as well. So the first thing is, now when you enter a hospital, you can't wear anything below the elbows. So if you are wearing long sleeves, you should make sure that it's turned, your sleeve is turned up to the elbow level. So when you perform patient care, when you are when you attending to a patient, it is important that you remove all your wrist jewelry, okay, including your wrist watch. Then so you can't have long nails, ladies and gents both. We can't have long nails as healthcare workers. So we can't have gel nails, we can't have nail polish, okay. So if the rings, jewelry, we cannot have rings with ridges and stones. This is only for when you are attending to a patient. After that, when you leave the hospital, we can have whatever we want. This is only when you are attending to a patient. But only a wedding band, a flat wedding band without any ridges and stones are allowed. Okay, so that is how you prepare or that is your attire for the hospital. Okay, so this is very important for our hand hygiene, because if you have wrist jewelries, if you have a wrist, especially a wrist watch, if you have multiple rings in your fingers, you cannot perform hand hygiene properly. Okay. So this is, I hope everybody have seen this poster. This is the poster by the WHO. It talks about 5 movements of hand hygiene. 5 movements means the simple meaning is the 5 instances or 5 places you do your hand hygiene. Obviously, you do hand hygiene before touching your patient. It is for the patient safety. And number 2 is before a clean and aseptic procedure. It is also for the patient safety. I will give you an example in here. Now, if you are caring for a patient, now if you in an ICU, we will take this example as an ICU. Now you are examining a patient, patient who is in the ICU bed, and then you want to perform a aseptic procedure like cannulation. It is also an aseptic procedure. Even it is the same patient that you have to do hand hygiene, because if you don't do hand hygiene, you will be introducing germs into the patient's sterile spaces. So when you are doing cannulation, you are entering into patient's bloodstream, which is a sterile space. So if you don't perform hand hygiene, you will introduce, it could be patient's own flora, but you will introduce it into the patient's sterile space, which is going to be very dangerous. Okay. Then after body fluid exposure, of course, it's for our own safety. And after touching the patient, it is also our own safety, and we will not be spreading the infection to other patient. And after touching the patient's surrounding, it's also for our own safety. So what are patient surrounding? Patient surrounding means the bed etiquette, bed railings, and things like that. So if the patient is on a wheelchair, the wheelchair is also patient's surrounding. Okay, patient in hand hygiene. So patient is the person and whatever which is attached to the patient, the cannula, the catheter, those are also we consider them as part of the patient. Okay, so before touching patient surrounding, you need not to do hand hygiene. So what do you need for hand washing? Hand washing is, of course, you need certain things for hand washing. Ideally, elbow operated tap or tap with automated sensors like this. It's best if you can have at least elbow operated tap in your setting. But if you don't have an elbow operated tap, what you can do is, after hand hygiene, you can use the hand towel to close the tap. Okay. Then ideally elbow operated soap dispenser. But if you don't have elbow operated soap dispenser, you can have bar soaps. So what you can do is, so bar soaps, the problem with bar soaps are, these bar soaps, they encourage the growth of some bacteria. It's a good medium for some of the bacteria. If I give you a name, it's Pseudomonas. Pseudomonas, they grow very well on bar soap. So what you can do is, you can cut this soap into small pieces, and at the end you can use one piece for the day, and at the end of the day you can throw it away. Okay, so if you don't have this kind of soap dispensers. And then single-use towel is a must, because there is no point of having a towel like this. You will be like contaminating your hand again and again even after washing your hand. And even these towels, when you repeatedly wipe your hand with a towel, there will be moisture in the towel, so it's going to be a very good culture medium for some of the bacteria, especially for Pseudomonas, okay, which is a known hospital pathogen. So you need these for hand washing. So alcohol hand rub is a better alternative for hand hygiene, because you don't need any of these for hand rubbing. But the problem with alcohol hand rub is, you can't use it when your hands are visibly soiled, it's obvious you can't put, like, if there is some blood or something on your hands, you can't put some alcohol hand rub on your hand. And you can use alcohol hand rub up to 10 times. After the 10th time, you need to wash your hands. And it's less irritating for your skin. So these are the steps of hand washing, both for hand washing and hand rubbing. It is the same steps. So I will not describing these. So you can go to this is a YouTube video. This is WHO video. Just click on this and you can watch the video and learn how to do the hand washing or hand hygiene properly. So why are we so worried about these steps and all? The reason is, if you don't perform all these steps, there are 6 steps. If you don't perform these, so you might miss some of the areas in your hand, especially fingertips, in between your fingers. So you might miss those areas. So there can be germs or the pathogens left in those areas, and you will be spreading those into the other patients, and you are also at risk. So now, how do you improve hand hygiene in an outpatient setting or your GP clinic? Because the reality is, in our hospitals and in some of the GP clinics, we have a heavy patient load. We get a lot of patients. We may have to sometimes see 40, 60 patients per hour. So it's very difficult. Then your priority is, even at ICU setting, in ward setting, your priority is to manage the patient, to give drugs to the patient, and especially in ICU, you just to keep the patient alive, but not hand hygiene. That is the reality at the ground level. So how do we improve, especially at outpatient? So the first one is to provide facilities. So you can provide a sink, you can provide soap, and you can provide towels. So if you go back to your wards and just count the number of sinks you have, so I know it's at the standard level. Maybe sometimes for 60 beds you have just one sink, which is then it's not practical to wash your hands while caring for the patient. Then we can place hand rubs at important points, like at the entrance, patient waiting area. Then patients will also use hand rubs. Now the positive thing of this COVID pandemic is, now patients are aware of these hand rubs and they know how to use it. So they will use it. That will reduce the infection, especially spreading of the infection in patient waiting area. So in the consultation room where you consult your patient, you can have a hand rub bottle on the table. So if you have a separate treatment room, have a hand rub bottle on that treatment room as well. Then nurse's station, and if it is a big place, then hallway, you can have on the attached to the hall few hand rub bottles. Medication room, wherever, you can have hand rub bottles. Then repeated training and education is also important. You have to train and educate everybody in your setting from top to bottom on hand hygiene. Then the next important thing is personal protective equipment. We use lot of gloves. So gloves are important to prevent infection, and especially to prevent ourselves, healthcare workers. But gloves sometimes might give us a false sense of security. So when you are using gloves, first thing is you need to, there are 2 types of gloves, sterile and non-sterile. Obviously sterile gloves are very expensive. than the non-sterile gloves. So you have to decide whether to use sterile gloves or non-sterile gloves for a procedure. Obviously, if you are entering into a sterile space in the body, or if you are touching a mucous membrane, then you have to use sterile gloves. All the other procedures, you only need clean non-sterile pair of gloves. If you now, the way you have to use gloves is you wear the pair of gloves, you perform the procedure and then you remove your gloves and you wash your hands. So you can't use one pair of gloves for several patients. So that is you will be spreading. That is one of the major mistakes most of us do. So you will be spreading the infection everywhere. And you should not touch anything else, especially your pen, the bedhead ticket, the telephone, and things like that with the gloves on. And one thing I want to stress is gloves is not a substitute for hand hygiene. Okay. Yes, gown is only for special situation where you anticipate lot of contamination from blood and body fluids. And gown is also the same story. You wear this gown, ideally this should be a single-use one. So you wear your gown and then after the procedure you remove it. Sometimes we tend to use one gown for the whole shift and things like that. That is just to save money, but that is not recommended because that you will be contaminating the surfaces, environment, as well as you will be transmitting infection between patients. So, because if you look closely, all these surgical gowns, they are long sleeve gowns. So it goes up, the sleeve goes up to your wrist level. So when you care for one patient, your sleeves, especially these sleeves, get contaminated. Okay, so after after caring one patient, you have to remove your gown. Gown is not necessary for each and every procedure. It's only for certain procedures. Face masks and respirators. So we have surgical masks and we have respirators. So everybody knows what respirators are these days thanks to COVID-19. So respirators or in other words N95 masks are only indicated for certain in certain infections, like typically if you are looking after Microbacterium tuberculosis patient or varicella zoster patient or a measles patient. Other than that, all the other patients, we just a normal face mask is enough. So, but there is this debate in COVID and influenza where you need a respirator or a face mask. So, in COVID and influenza patient, if you are doing a sort of very if you're doing an invasive sort of procedure, respiratory procedure, where lot of droplets are generated, there is a risk of droplet generating, like intubation or suction, then you need a respirator. Other than that, a general face mask is enough. So if you have any doubt, now this is a very sort of a controversial area. If you have any doubt, you can always contact the infection control team at your hospital or the microbiologist and clear your doubt. So this is the N95 mask. So there is a way of wearing and removing, donning and doffing of this PPE. Now when you are wearing, the first thing you wear is your gown, then you wear your mask and goggles if needed. Then last thing is the glove. This is to prevent glove contamination. Then when you are removing then you are removing, it's the other way around. I'm sorry, I have put the same thing. When you are removing, you first remove the glove, and then you remove the glove and you do hand hygiene. Then you remove your goggles and face shield, and then the mask and respirator, and the last thing you remove is your gown. Okay, that is to prevent contamination. Okay, you first remove your contaminated gloves. So respiratory hygiene is very important in the OPD setting. Thanks to COVID, everybody knows what respiratory hygiene is these days. So this is very important in the patient waiting area. This is actually for the patient. So especially when there are respiratory infection outbreaks, common cold outbreaks, you can take special precautions at the OPD setting or at your GP setting, where you can advise patient to take extra precautions, and please be mindful about respiratory hygiene, like when coughing and sneezing, just to cover the nose, and after using tissue, put them into a waste paper bin. Have a separate waste paper bin for this, and supply materials for hand hygiene in the waiting area, and make sure that they use it. And when you are caring for patients also, especially during this respiratory outbreaks time, you can wear a mask, surgical mask. Just a simple surgical mask is adequate, and have a hand hygiene bottle, 70% alcohol 70% alcohol bottle with you, and do hand hygiene frequently to prevent you getting infected. And another little thing is, you can have if you get lot of patient to your OPD or your GP setting with respiratory infection, maybe you can have a small separate area for this type of patients. Then that will also help us to prevent cross infections. Another important part, and this is the management of patient care equipment, how to sterilize and clean our equipments. I will briefly now. This is a very vast area, and it's always little bit of a confusing area. So I will only mention about these critical items and non-critical items. Now, if we take all items we use for patient care, we can divide them into 3: critical, critical, semi-critical, and non-critical. Critical items are these items, the surgical items we use for surgeries, and these this is another critical item we very frequently use, the needle. So these items, they enter into the patient's sterile tissue, sterile spaces, or vascular spaces. So obviously we have to sterilize these. If these items are single use, then those are single use. So we have to sterilize these according to manufacturer's instructions. So most of the time we have to use steam sterilization or autoclaving. Okay. So generally in OPD settings, we don't use semi-critical items. Examples for semi-critical items, one example is endoscopes. We don't use endoscopes. But we use lot of non-critical items. The mistakes we do here is we use we sterilize these items unnecessarily. Actually, we don't have to sterilize these items, because these items, they only touches the skin. Our skin is very robust, and it is a very good barrier for pathogens. So these items they only need low level disinfections. Low-level disinfection means just to wipe these items with 70% alcohol. So if you use like in your GP setting or in your OPD, your blood pressure apparatus, the bedpans, wheelchair, especially the thermometer, don't try and over disinfect this. Just use just 70% alcohol pad to disinfect this. That is more than enough. Other important area is waste disposal. Now in waste disposal is also a very vast area. So we generate in hospitals, we generate both hazardous and non-hazardous waste. Hazardous waste are the waste generated when we care for patients. For an example, whatever the material we use for patients excreta, the material contaminated with blood. So those are the hazardous waste. Then there are a lot of non-hazardous waste as well, the leftover food and the paper material. So those are non-hazardous waste. So we should not mix these two because it's always very expensive to manage and dispose hazardous waste. So at your hospital or your setting, GP setting, you can have these type of bins, one bin for hazardous waste and one bin for non-hazardous waste. And we have a color coding system, a national color coding system for this, which is given by the Ministry of Health. And other important waste we generate in the hospital is sharps. It is very important that we discard sharp appropriately. One main reason is if we don't discard sharps appropriately, there can be accidents. Okay? There can be accidents. And the other thing is if these sharps, if those goes to to unwanted people, access to them, there sometimes people recycle, especially syringes and needles for money. So that recycling is not proper. So that also should be prevented. So every healthcare institution, every ward, every clinic should have a sharp bin. So these are the ideal sharp bins that we purchase. These are a bit expensive, but if you don't have if you don't have facilities like this, what you can do is you can have an alternative, maybe a plastic bin or a cardboard, but it has to be a very hard cardboard that cannot be pierced by the needle. A cardboard bin which has a opening on the top like this. The opening should be on the top, not at the side of the bin. Okay, so your sharp should go into this. So once the 3/4 is full, this has to go for autoclaving. So ideally for autoclaving and shredding. If you are doing an independent practice, you can have a sort of understanding with some sort of agency for this. So this should not be done, the overfilling of the sharp bin, because this will increase accidents. So how now I have discussed some of the important areas of IPC. So how would you apply these when you are doing a small procedure at your outpatient setting especially? So one is I have taken one example, wound dressing. When you're doing a wound dressing, so first thing you have to collect everything you need for the procedure. So you have to decontaminate your hand, either washing your hands or hand rubbing. Then all the equipment has to be sterile. then you know, obviously the wound will be covered. If you touch the outer area and if you undress the wound, then you have to decontaminate your hands again, because you have contaminated your hands by now. So if you have like, you know, gloves on at this point you have to change your gloves, okay, at number 4. Okay, so then you can perform the procedure, remove your gloves and discard equipment safely and do hand washing. So that is how you perform this simple wound dressing procedure. If you have if you understand the whole, like the principles of IPC, then it's easy for you to work this out. So respiratory tract prevention of respiratory tract infections, I have already discussed this. So just, you know, provide facilities to the patient and encourage hand hygiene, because respiratory tract infections, they spread by touching as well. And you can just, you know, display one of these posters at your waiting area. Then contact precautions to prevent skin infections and other viral infection. Ideally, we have to isolate the patient, especially if you get a patient like hand, foot and mouth disease, MRSA skin infection or scabies, you have to isolate the patient. Then do hand hygiene, then discard or clean all equipments you use for the patient. If it is an inward patient, you have dedicated equipment, and then do proper waste disposal. So those are the precautions for skin infections which spread by contact. Yes, that is all from me for today. So if you have questions, you can now it's the time for questions. And one small thing I want to mention, now there is a guideline, very sort of comprehensive guideline published by the Sri Lanka College of Microbiologists on IPC. So that gives a lot of details on IPC. So if you have any issues or problems, you can always access it in their website, and you can go look for the details.
So we are waiting for questions from our audience. This is a really interesting lecture. Though this is very common topic that we are very familiar in our medical practice, I hope that we have many questions that to project to our madam. Madam, we have a question actually from a participant. Regarding sterilization of equipment used in general practice, what should be the best practical procedure?
In a JP setting.
Yes, ma'am.
So it depends on what you use. As I already mentioned, if it is a non-critical item, non-critical item means if that item only touches the patient's skin. For an example, a thermometer or a blood pressure monitor, then all you have to do is to use a 70% alcohol. But if you use if you use critical items like injections, suture materials, then those has to be sterilized properly. So either you can have a small autoclave in your place if you do have facilities, or you can have a place to get those autoclaved properly, maybe another hospital or something like that.
So yes, there is access to that we can
form of, yes, if you are running an independent practice, you can have a sort of you can look for a place and you can develop that sort of a relationship with that particular place. And I think there are commercial commercial companies also who provide that service.
Promoting
yes. But in government hospitals and big hospitals, it's not a problem, because they have what we call CSSDs, Central Sterilization Units, where they do everything properly.
Yes. And also we have another question. What about the single-use item reusing, madam?
This is a problem, especially in a third world country like that. Like when we practice day to day practice, we always try to save money, especially in government sector. We think it's our money, it's people's money, and we always try to save money.
And also sources.
Yes, resources. We try to save resources. So, but the single-use item, it's a single-use item because today, like most of the time for patient care, we use commercial supplies. Even like for our suture material, if you take even simple things, a syringe, a needle, it's all supplied by a commercial company. So they will tell us what to do and what not to do. So if they say that this is single use, it is single use. For sometimes complex procedures, we use we have to use single items. Sometimes those are very, very, very expensive. So, but still, if they say it's single use, it's single use. The problem is now the methods we use for sterilization will not work for those. Some of these materials, they have very small caliber, so the steam will not penetrate. So we as medical, even the microbiologist and other medical professionals, we are not experts on those. Like we can't say that whether it's going to work or not. So if it is single use, it's single use, unfortunately.
So I think, madam, this is a very interesting to have this lecture on today. Really nice to meet you and very much of thank you.
Thank you very much for inviting me. Thank you.
Thank you.